What is biostatistics for USMLE Step 1? Imagine trying to make sense of a mountain of medical research or figuring out how likely a patient is to develop a disease. That's where biostatistics comes in. It's a key part of the USMLE Step 1 content because it helps you understand and interpret data in medicine. When you see a research study or a graph on the exam, knowing biostatistics allows you to figure out what the numbers really mean. It's like having a special language to talk about health data. Biostatistics covers several important areas. First, study designs are fundamental. You need to know the difference between research types like prospective studies that follow people forward and retrospective studies that look back at past data. Case control studies compare people with a disease to those without, while cross-sectional studies look at data at one specific point in time. Randomized controlled trials are experiments where participants are randomly assigned to different treatments, and they are considered the gold standard for testing new therapies. Ecological studies analyze data at the population level, and case series describe groups of patients with similar features. Next, understanding how often diseases occur is important. Incidence tells you how many new cases happen over a certain period, while prevalence shows how many people have the disease at a specific moment. Mortality and morbidity rates give you information about death and disease impact in populations. When it comes to diagnostic tests, you need to evaluate how well they work. Sensitivity measures how good a test is at catching true positives, while specificity shows how well it identifies true negatives. Positive predictive value tells you the chance that someone with a positive test actually has the disease, and negative predictive value shows the chance that a negative test means no disease. Receiver operating characteristic curves are graphs that compare sensitivity and specificity at various thresholds, helping you see how good a test is overall. Risk estimation is another key part. Relative risk compares the chance of disease between two groups, while odds ratio is used in case control studies. Attributable risk shows how much of the disease can be linked to a specific factor. Absolute and relative risk reductions tell you how much a treatment lowers risk, and number needed to treat or harm helps you understand how many patients need treatment to prevent one case or cause one adverse event. Basic statistical measures help describe data. The mean is the average, the median is the middle value, and the mode is the most common. Variability measures like standard deviation tell you how spread out the data is. Knowing whether data follows a normal or skewed distribution helps you choose the right analysis. Lastly, survival analysis looks at how long patients live after treatment or diagnosis. Kaplan-Meier curves show the proportion of patients surviving over time, which is often tested on the exam. All these topics are woven into clinical scenarios on the USMLE Step 1. You might see tables, graphs, or case vignettes that requiring you to interpret data or evaluate research results. Mastering biostatistics helps you critically analyze medical literature, make evidence-based decisions, and understand population health. It's a vital skill set that supports your overall clinical reasoning and scientific literacy.